This is Varlina Jenkins, nurse practitioner student of the University of Texas at Arlington, 10017192250. This is for a pediatric health assessment. Here's a 360 of the room. And here are the exam materials. Hand hygiene. Okay. Hello, I'm Verlene. I'm going to be your nurse practitioner. Do you consent to this video being done today?
Yes.
Okay. And this is going to be a head-to-toe assessment. I won't be asking you any questions about your prior medical history. We're just going to be examining everything from your head to your feet.
Okay.
Okay. And how would you like to be addressed for this video?
Cheyenne.
Cheyenne. Okay. And your age?
20.
20. Okay. So, can you just recite to me what the date is?
It is the 29th of October of 2019, and it is Wednesday. Tuesday, I'm sorry.
Yes, you're correct. Okay, so patient is alert to place, and she's also oriented to the date and time, so she would be considered alert, awake, and oriented times 4. She does know her age, as well as her date of birth. We're gonna go ahead and get started with the head first, doing the hair and nails. Okay. All right. So just a general inspection of the skin. The skin is consistently brown here in the limbs. Your arm here, and then the arm here as well is consistent in color. It is free of rashes. I don't see any outbreaks or lesions. And then, let's see, the patient does have, looks like they're false as acrylic nails.
No, they're mine.
Oh, they're yours. Okay. So I can't see the capillary refill in the nail bed, but we'll just do the fingertips, and it is less than 3 seconds. Then we'll do it here. Okay, skin is warm to the touch and dry. Sorry. Okay. Alright, so first I'm just going to examine the hair. The hair is black in color and wavy. Just feeling it here, it's not dry, it's not oily, and there's no presence of hair loss or thinning. Touching the scalp here, I don't feel any sore. Is it sore anywhere? Okay, I don't feel any swelling going on, and it's not tender. Okay, the scalp here, it's not red. Do you have any problems with itchy or dry scalp or anything like that?
Sometimes.
Okay, any hair loss?
Mm-mm.
Oh, okay. But yeah, the texture is wavy and curly, and it's full hair, and I don't see any areas where there's spotting or anything like that. Okay, and now we'll go to the facial appearance. So here on the face, the skin is also consistent with the rest of the body. She's brown in color. And here, you see the face, and it is symmetric. There's no deviations in her face. Also, I don't see any areas where one side is drooping. It's consistent. Are you having any soreness in your face or anything like that? No? Okay. So yeah, the forehead here. And since we're already on the face, I'll go ahead and palpate the maxillary and frontal sinuses. Here is the frontal sinus. Is there any tenderness or pressure when I press there? Okay, and what about here? Okay, all right, so no tenderness on the maxillary or frontal sinuses. Okay. All right, so move the hair back. Just looking at the ears here, and they are also consistent with the rest of her skin color. I don't see any edema or drainage here. And looking from the ear, we have the outer eye canthus here with the pinna, and it is leveled here on this side to the right. Okay, and to the left. Just looking for the placement of the ear. You can turn it there.
I'm sorry.
You're fine. And the outer canthus does level off with the pinna here. Okay, so the ear's in the correct position. This ear is also the same color as the rest of her body. Just dry. Okay. Alright, so now I'm gonna go ahead and palpate what we call lymph nodes. So I'm just gonna start off here with the pre-auricular here, and the post-auricular here, and then the occipital lymph nodes here. You can turn toward the camera there, you can see. Okay, and now we have the posterior cervical lymph nodes, and we have the anterior lymph nodes. And here we have the tonsillar and the submandibular, the sublingual, and the submental. And all your lymph nodes, they're all movable. Was there any tenderness when I touched in those areas? No, but they're movable, they're not warm, anything like that. So far so good. Now I'm gonna palpate these subclavicular lymph nodes here. Okay, and if you can lift your arm up for me, are you ticklish?
Yeah.
So we're gonna do the auxiliary lymph nodes here. Okay, other side. Okay, and then the epitrochlear lymph nodes here. Okay, those are also movable. No tenderness or anything while I was touching them. Okay, great. So since we already went through the hair and skin and the nails, they're all great here. No lesions, no rashes or anything like that. Everything looks good. Okay, and I'll also get further down here. We can check your toes. Kind of get further down.
Do I need to scoot back?
I'll scoot back a little bit. Okay, and we're just examining the rest of the skin here. It's uniform, same brown color. And the toes here. Have the capillary leaf fill less than 2 seconds here. Consistent in color. I don't see any discoloration anywhere. Uniform, consistent in color. Okay, now if you come closer, since we examined the skin and nails and we also did your head, now we're gonna go to your ears now.
Okay.
So if you do, we can just hold your hair back that way. Okay, and I will be examining ears with the otoscope here. And we'll put a cover on it. Okay, so I'm just going to shine this light into your ear. I'm going to pull it up and back, but I'm just going to shine this light you see into your ears, and I'm going to look into the structures of your inner ear.
Okay.
Okay, let me know if it's uncomfortable at any time.
Okay.
Okay, alrighty. So I'm going to pull the ear up and back. Put this right here. Is it uncomfortable?
Yeah, just a little.
Okay. So what I'm looking at is your tympanic membrane, and it's pearly gray. I can see the reflex light here at 5 o'clock. The light in your ear. Sorry.
No, you're fine. Just tickles.
I'm sorry. Alright, and your tympanic membrane is not obstructed by any cerumen. That's just earwax.
Earwax.
Okay. Alright, and it's free of effusions. I don't see any bubbling there. It's not swollen. Yeah, your tympanic membrane looks great.
Awesome.
Alright, so now we're going to look at the other ear. I'll brace here. Sorry, I know it's a weird feeling. Alright, so we're going to brace and go in like the other side. Okay. Alright, up and back here. Looking at your tympanic membrane, this is also a pearl gray color. And I see the reflex at 7 o'clock. That's your light reflex. Okay, no swelling going on. I don't see any drainage. Okay. Yep, tympanic membrane intact. Looks good on that side as well.
Awesome.
Sorry, I know it tickles. So sorry.
No, you're fine.
But since we're already at your ears, we'll go ahead and do the Rhine and Weber test. I'm basically just testing for your acoustic or cranial nerve number 8, since we're already on the ears. But just seeing her ears are free of drainage here, looking inside the tympanic membranes, they're both pearl gray. I saw the light reflexes and the structures of the ear as far as the hammer. They all are intact, no bubbling. Looks great. No drainage to the outer ear here, consistent with the rest of her body's color. Okay, so I'm just going to strike this light here, and you can let me know if you hear it equally on both sides or not. Okay?
Okay.
Okay? Equal on both sides?
I don't know. I kind of hear it more on this side.
Hear it more on that side? Okay. And let me know when you feel it stop vibrating.
I didn't feel it start.
Then,
No, duty.
let's do it again. Okay.
Okay.
Is it equal on both sides or?
Now it is.
Okay, and here.
Okay.
Just let me know when you feel it stop vibrating.
Now.
Okay, let's do the same on the other side. Equal in both?
Kind of hear it more on this side.
More on that side? Okay. And let me know when you feel it stop vibrating.
Now.
Okay, great. So that just tests for any hearing loss. I don't know, maybe because of me just looking in your ears, maybe you felt it more in one ear because you know you're ticklish. But you passed. I'm just making sure there's no hearing loss. Now I'm going to do the whispered voice test, which also tests your cranial nerve 8 or acoustic nerve. So if you can just wiggle one of your ears like this, and then on the other ear, I'm going to whisper 3 things in your ear. It's called the whisper test, and you let me know what you hear. Okay, so wiggle that ear.
This one?
And I'm just going to whisper here.
6 baseball pink.
Okay, and we'll do this ear. You're going to wiggle. Wiggle this ear over here, and I'm whispering this ear.
Oh, I'm sorry.
Oh, you're fine.
Purple basketball and 9.
Okay, great deal. All right, so now since we've done your ears, we're going to move down to your eyes. All right, so I'm going to darken the room a little bit here.
Okay.
So I can view your red light reflex in your eyes. It's the ophthalmic scope we're going to use. Okay. So I'm going to look in your right eye with my right eye. Okay. Make sure we get it. Let's see here. Okay. Okay. Alright, so I see your red light reflex. And I see your vessels here in your eye free of hemorrhages. And I saw your, oh, now my eyes watering, sorry. But I saw your optic nerves, there's no hemorrhages, they're all uniform. And I saw the disc, it's also bright in color. Your fundus, which is basically the background of your eyeball, it's consistent on any areas where there's any exudates or anything like that. So when we look in your left eye, and we're gonna do the same thing, you can just kind of fixate on that clock over there, and then I'm gonna look here. Look to the left. Okay, so you do red light reflex. I also see your optic nerves and vessels there. They're all uniform. There's no areas of any exudates or little white woolen patches or areas of hemorrhages. That is a sign of diabetes or hypertension uncontrolled. And those areas look great. I saw your optic disc looks fine, intact. Everything looks great in your eyes. Okay, so we're gonna turn this light back on. Now we're gonna go ahead and do the vision test. We're just gonna test your optic nerve number 2. So I'm gonna get a Rosenbaum chart here, and you can just read it off for me.
Okay.
Come a little bit closer. Okay.
Do I do
There.
my
Okay.
right or?
Let's do your right eye first, then your left, and then we'll do both.
Okay.
So can you just look at it and point to me which line is easier for you to read?
Well, the easiest is that one, of course, but I can see that one.
Oh, whichever is easiest. It doesn't matter if it's the big one or not. It's just
Okay.
whatever is comfortable for you.
Alright, 6.
Really good start. I can see too.
This
Okay.
one. I was reading that one.
Okay,
6,
perfect.
3, 8.
Mm-hmm.
EW. I don't know what that is. That a backward T?
Yes. Mm-hmm.
And then X and OO, or is that a 0? I'm not sure.
Mm-hmm.
XOO 1410.
Okay, great. And that is 2100. So what you see at 220 feet, others see it at 100 feet. We'll go ahead and do the left eye now, so you can cover your right. Perfect. And point which line is easy for you to read for me.
That one is
That one's the best. Okay, go
Mhm.
ahead.
63925 ME, the backwards E, XOX 85.
Okay. All right, and that is 20/50. So what you see at 20 feet, others see at 50 feet. So again, that's the Rosenbaum reading chart, and we were testing your visual acuity, which is optic nerve number 2. So since we're already on the eyes, we can go ahead and do the uncover test. This is going to test for your extraocular movements as well as your peripheral vision. So here's some folded pieces of paper here. If you can just face me, we're going to go ahead and do this. Okay. All right, so you're going to cover your right eye. I'm going to cover my left. Okay, and you're just going to tell me when you see my fingers wiggling, okay?
Okay. Now.
Okay.
Now. Oh, I'm cheated. I'm sorry.
So,
Now.
all right, uncover your eye. All right, I'm just seeing how fast your pupils react. Okay, we'll do your left eye and my right now, and just let me know when you see it wiggling.
Now.
Okay, you can uncover. Okay, great. All right, and now we're gonna do the 6 cortical fields of gaze. That's gonna test your extraocular movements. That's gonna test for your cranial nerve 3, 4, and 6, or abductens, trochlear, and the supratrochlear fields of vision. So you can turn towards me, we'll get a little closer to the camera, sorry. And abductens, sorry. Oculomotor, abductens, and trochlear, or 3, 4, and 6. Okay, and lean a little bit towards me. We'll get you on the camera. Okay, so I'm just gonna hold your chin here, and you're basically just gonna follow my finger wherever it goes, okay? All right. Okay. 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 All right, great. All right, so you can face toward the camera. Those were great. Your eyes were able to follow my finger correctly. I didn't see any nystagmus or where your eyes are basically, twitching. They were able to follow through the gaze evenly. Okay. So now I'm going to shine this pen light in your face here, and I'm just going to look at your pupils and how they react to light.
Okay.
Okay. Okay. Great. They're reacting to light. Okay. Great. And since we're on your eyes, I'll go ahead and put some gloves on here. I'm just going to look at your conjunctiva and then palpate your eyelids and your the structures of your eyes as far as your sclera, just to make sure everything looks good there. Okay. So now I'm just going to pull your eyelids down. Okay, your conjunctiva is pink, no swelling. All right, I'm just going to touch your eyelids here. Is there any tenderness there? I don't feel a gritty texture. Great, and your eyebrows, they're consistent. The hair is dispersed evenly there. Okay, and just looking at your eyelashes, they are curling outward. Okay, there's no crusting or anything like that. The sclera is white, your lens is clear on both sides. And then this is your lacrimal apparatus here. It's not tender. And then your lacrimal gland here. That's not tender. Okay, great. So now since we've used that, we're going to go ahead and move down to your nose. Okay, so for your nose, we're going to use the same otoscope here, and I'm just going to shine this light into your nostrils. Oops. Let me get another one. I just dropped it. All right, so just looking at the outer surface of the nose, the bridge is even here. There's no deviations to either side. It's consistent in color with the rest of her skin. Okay, and then if you could just tilt your head back for me, and I'm just going to view your nose, okay? I'm going to lift here. All right, and your septum is even or midline. Your turbinates are pink. I don't see any crusting or any areas where there's any blood from nosebleeds. Looks great. There's no drainage. Get on this side.
Any boogies?
Oh no. Okay, it's pink here. Your turbinates are pink. Okay, and the floor of your nose is also pink too. I don't see any areas of crusting. It's midline. Okay. Alright, and since we're on your nose, we can go ahead and test cranial nerve number 1 or olfactory. So if you can do me a favor and close your eyes. Alright, and tell me what you smell there.
Can you do it one more time?
One more time. Okay. Okay.
Alcohol.
Alcohol, great. It was an alcohol swab. Okay, great. So that's intact. Now we're gonna go ahead and move down to your mouth. So once again, I'm gonna change my gloves because I'm gonna be touching your lips.
Wow. My lips are good.
All right. And I'm just gonna shine this pen light in there again. And I'll be moving your tongue around, so I'll be using a gauze here for that. Okay. Can you open your mouth wide for me? Okay, just looking at your oral mucosa, it is pink. I don't see any lesions there.
2024.
I think that'll be good. Okay, I see your teeth. They're pearly white in color. You look on the other side. Can you say "ah" for me? Okay, your uvula is midline, no deviations. And your soft and hard palates, they are pink. I'll say "ah" one more time for me. Your tonsils are about a 1+. And can you lift your tongue up for me? Okay, great. All right, nice and pink, uniform in color. Now I'm just gonna touch your mouth here. There's no soreness. Kinda. Oh, okay. Alright, and then can you open your mouth for me? I'm just gonna touch you and your gums, no soreness or anything. Okay, great. Alright, let me see your tongue here. Can you stick it out for me? Okay, just look and view your tongue. It's nice and pink. No areas of discoloration or sore. Great. Alright, and since your tongue is already out, can you lift it up to the front like you're gonna touch your nose? Okay, great. And down like you're gonna touch your chin. And we're measuring cranial nerve number 12, or the hypoglossopharyngeal nerve. Okay, and then move your tongue side to side.
I'm sorry.
That's fine. Okay. Okay, great. All right. So here, I'm gonna test for cranial nerve number 5. I'm just gonna make sure there's no grating. If you can clench your jaw for me. All right, and move it up and down. Okay, and then act as if you're chewing. Okay, there's no grating sensation or anything like that. Okay, great. Oh, sorry.
You're fine.
Okay, also while I'm at your neck, so I'm just gonna feel for your neck. And right here, if you can lift up, I'm just gonna feel for your trachea. Okay, and it is midline. All right, if you can go ahead and drink this water for me. Okay, and swallow. Okay, your hyoid bone there. Okay. Any soreness with swallowing or anything? Okay, great. So your trachea is midline. You're fine. All right, now I'm just gonna feel for your thyroid. Okay, so I'm gonna palpate the left side here. So you feel the lobe there. Any tenderness here? I don't feel any gritty sensation there from your thyroid, so that's great. For the right lobe. Okay, it's nice and smooth. No areas of grittiness. I'm gonna go ahead and listen to your pulses here, your carotid pulses.
Oh.
Okay. Yeah, I'm listening to your neck here.
Do I need to move?
No, you're fine. I'm just checking to see if there's any presence of a bruit or any thrills here. I'm gonna palpate. Okay, that's a nice 3+. I don't feel any thrills. Okay, great. All right. So now, since I'm already palpating for your pulses, I'll just finish them out. And we're gonna feel for your brachial pulses here. Okay. And then here for your radial pulses. Move the camera down. Okay, so far they're all 3+, and if you can scoot back, we're gonna check your dorsalis pedis and your posterior tibial pulses. Oh, thanks. Okay,
So I
have
just-
a seat.
Oh,
Yeah, we'll just.
I'm sorry.
It's okay. Okay, and you can lift your foot up for me. Okay, great. And your posterior tibial. Alright, your dorsalis pedis here. Okay, still 3+, and then your popliteal pulses here was, okay. Yep, they're all 3+, that's great. Okay, now we can go ahead and listen to your heart and lung sounds. So if you can, scoot closer to the camera. So we're gonna first start off by listening to your back here for your lung sounds. So if you can, we'll stand up real quick and turn the chair this way. And then you can face sitting that way.
Like this?
Mm-hmm. Yes, that's great. Alright, and I got my watch here so I can time your respiratory pattern. Okay. Okay. Alright. Okay. Alright. And if you could just deep breathe in and out for me as soon as you feel the stethoscope. Okay. 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 Let me do that side again. I was right on your bra. Okay, and I'm just gonna lift this up to listen, okay? Okay. Okay, now if you can, I'm just gonna percuss your back here, okay? Try that again. Okay, great. Now you can turn to your right side, face the camera. I'm just gonna listen to your lateral lung sounds here.
Oh, like this?
Yeah, and you can lift your arm up here. Back up over here. Perfect. Just listen to your back. They're vesicular lung sounds or clear lung sounds. Okay. Okay, and now listen here. Deep breathing out for me. Okay. Okay. Okay, and then I'm going to percuss these areas as well. I'm just checking for any resonance. Okay. Okay, great. And you can turn to the other side or left side. And we'll probably have to turn the chair over. Yeah. There we go. Okay, you can lift your arm up for me. Okay. So listen here. You breathe in and out. Okay. Alright. Now percuss here. Okay. Great. And now we're going to do the front. But all your lung sounds are clear. I don't hear any crackles or anything like that. Your chest movements are even. I was looking at that as well. And just looking at your anterior chest, I don't see any thrills or heaves present here. Your breathing pattern is normal and even. Okay? But yeah, I don't hear any adventitious lung sounds here. They sound clear. Okay? Alright, so we're going to listen here and keep breathing it out. Okay. Sorry. Okay, and your lung sounds are also clear in the front as well. Here, I heard your bronchial lung sounds. They're a little bit more prominent there. They're not going to be as vesicular as your lower here, but yes, they're all great. I don't hear any deviations or anything like that. No crackling or absent. They're all present vesicular lung sounds. Okay, so now I'm going to also listen to your heart sounds. Okay, and when I do that, I'm going to be listening with the diaphragm and then the bell of the stethoscope. This is going to pick up the lower pitch sound. So once I go through this way, I'm basically going to do a reverse with the bell in the same pattern.
Okay.
Okay. Alright, but first let me go ahead and count your respirations here. You can just breathe normally. we'll say respiratory rate is going to be 16. Okay. All right. So first we'll start off here. All right, with the second intercostal space on the right side. This is your aortic. And the left intercostal space, pulmonic. And then the third intercostal space, Erb's point. And then here your tricuspid, fourth intercostal space. And then in your mitral here, which is your fifth intercostal space. And now I'm going to do the valve. This side. Okay. Mitral. Okay, great. So I don't hear any murmurs or anything like that. It's an equal S1, S2 heart sounds, or a love dub is what we call it. But I heard them in all areas. I didn't hear any type of murmurs or anything like that. Okay, so that's great. So now I'm going to palpate for your precordium. We usually do check the heart sounds in 3 positions, but this is the best one for you right now. We'll just do the sitting positions, but there's also a lying and then lying on your back as well. Okay, well, we'll just do this. All right. Precordium here. And then here's your apical pulse, and then I'll just count here your pulse rate, okay? Okay, it's 60.
Is
That's
that
great.
bad? Or
No, that's
normal?
good.
Okay.
Pulse rate could be 60 to 100. Some people fall below and are at the 50 range because that's their normal. What's usually your normal when you go to the doctor?
60? Actually, yeah, like
It's
in a
60?
60. No, I actually think about
Okay. Okay, great. Well, that's what I got, so that's great. So now we're gonna go on down to the abdomen. Okay. All right, so you can lie whichever way. Okay. All right, so just a general inspection of the abdomen. There's no presence of protruding veins there. The color is consistent with the rest of her body. The contour is flat. Okay. All right. So first, I just did my examination of your stomach. Now I'm gonna listen. Okay. Okay. All right. So the right upper quadrant here. Okay, you have active vowel sounds. There's the left upper quadrant. Okay, active vowel sounds. Left lower quadrant. Active vowel sounds. Right lower. And also active. All right, so now I'm going to percuss your stomach here. Okay. Okay. I don't hear any dull areas. It all sounds tympanic here. And now I'm just going to test for your gastric bubble. It's going to be, just lift this up just a little bit, sorry.
No, you're fine.
Okay, it will be here. That's where it changes in sound. And now I'm going to percuss for your splenic area here. Splenic dullness. Okay, we'll be there. And now, let's see, it'll probably be, so now I'm going to percuss here for your liver there. It'll be easier to beat this way. Okay, take a deep breath for me. Okay. In. Okay. Any soreness there, tenderness?
A little.
Just a little bit? Okay. Alright, just palpate for your liver but it is smooth. I was just percussion basically to see where it lies here, and it's right here.
Okay.
Okay.
Oh, is that why it's kind
Yeah,
of?
there we go. Okay, all right, great. So active bowel sounds in all quadrants, splenic and dullness here to the liver, gastric bubble here, and now I'm gonna palpate all quadrants of your stomach too, okay? So I'm gonna start off with light touch, medium, and then heavier,
Okay.
okay? So this is light touch here. Smoothness, I don't feel any areas of any. Okay, great. Okay, so that was light. I don't feel any lumps there or any type of hernias is what I'm feeling for, any tenderness. So this is gonna be medium. Okay, no tenderness? No? Okay, still don't feel any type of hernias or anything like that, no lumps. And this is gonna be deeper pressure here. Any tenderness? Okay, great. All right, great, you can sit up for the video. So since we're doing your abdomen, I'm gonna go ahead and check for costovertebral angle tenderness. So these chairs back. So basically we're gonna do the same thing with this chair and then turn it sideways again. With your back face to the door there. This way, sorry, the other way.
So with my.
You're gonna face toward the door and then your back is gonna be turned toward the camera. Great. Okay, I'm gonna put here. Any tenderness? Okay. Any tenderness? Okay. Also, while your back is turned, I can check for tactile fremitus. All right, I'm basically just gonna feel for the vibrations while you say the number 99. So as you feel my hands here, just say 99.
99.
Okay.
99.
Let's see. Okay.
99.
Over here. Okay.
99.
Okay. Negative for tactile fremitus. Okay, you can turn back towards the camera. Okay, great. So now I'm gonna check for your sensation here in your hands. We're gonna test here and then at your feet too. Okay, so if you can close your eyes for me. Right or left?
Left.
Okay.
Left.
Okay.
Right.
All right, and I'm gonna move down and stretch out your legs for me. Okay.
Right.
Actually. Okay. Okay, what specifically am I touching?
My big toe. My right big toe.
Okay, and let's do the left side. Okay.
My ankle. My left ankle.
Okay, great. Alright, so your sensation is adequate as well. So now we can test for your range of motion. So if you can move your wrist for me. Okay, active range of motion in the wrist. You're just testing for your musculoskeletal portion at this point. Okay, so hands down, up. Okay, and then quick up and down. Okay, great. Wiggle your fingers for me. All right, and now we're gonna lift your arms here. We're gonna check for your shoulders. You can do this one. But basically lift your hands over your head, great. And then down. And then make a circular motion here. Great, and then raise your hands back as far as you can. Okay, great. No soreness, stiffness, popping, anything like that?
soreness in this one.
No.
But that's what I sleep on.
You sleep on that side? Okay, great. All right, so now we can do your neck, range of motion in your neck. You can put your neck from side to side. Okay, to the right side. And then to the left as if you're touching your shoulder with your head, same thing. Okay, great. And then forward flexion of your neck and backward hyperflexion. There's no soreness, popping, or anything like that. Okay, and if you can, turn your neck side to side from the left to the right. Okay, great. Active range of motion in the neck. Okay, great. All right, now we're going to move down to your hips so you can stand up. Okay, great. And what you're basically going to do is twist side to side.
Like that?
Just the top half. Just the top half. Side to side. Okay, great. Check it for your hips as well as spine. And then as far as your knees. Okay, bend your knees back. Front to back. Great. And on the other side as well. Oh.
I'm sorry.
Okay, same. Left and right. Okay, now we're gonna do adduction on the right side away from your body, and then adductions to your body. Okay, same to your left, abduction, and then adduction. Okay, great. And now we're gonna test your balance with the Romberg test. You can close your eyes for me, and I'll be here to catch you. I'm basically just gonna move you like this and test your balance. Okay. Okay, great. You can open them now. All right, and we're gonna have a seat again here. Have a seat, and we're gonna test the range of motion for your
Feet.
ankles. So you just move them around for me. Great. The right and the left. Okay. And then move your foot inward, your right foot inward and out. Okay, same with the left. Inward and then out. Okay, great. And now I'm gonna check for your plantar flexion here. Oh, all right, give me your foot here.
Oh, this one?
Yeah, that'll be
Sorry.
fine. All right, I'm just gonna test for reflection of your foot. Okay, all right. Does it tickle?
Yes. I'm sorry.
All right. Okay. So, that's great. And we can also go ahead and test your Achilles reflex here with the reflex hammer. So if you can, just kind of, we're gonna get your ankle and then here, all right, here, okay, all right. And now we're gonna do your knees or patellar reflexes. Okay, okay, and your leg here, okay. Now we're gonna do your brachial reflexes. We'll test here. Okay. Okay, and then here to the back here. Check for your triceps. We just did your biceps. Okay. Your tricep here. Okay. Great. Right now, so now we'll do the scoliosis test and we'll do the heel to toe test. We're also just checking for balance and coordination. So if you can do me a favor, we're gonna clear these chairs out of the way. Okay, great. So if you can stand about right here and you're gonna turn toward the door, and I need you to bend down and touch your toes. Okay, this is the you just wash your mouth.
Sorry.
So we're checking, we're doing the scoliosis test, and it is negative. I'm basically just seeing if there's any curvature to your spine or back here when you're bending down, and there isn't, so you can stand up, that's great. And now scoot back about a couple of feet. There. Now we're gonna do the heel to toe test. So basically just walking a line heel to toe, checking for balance, coordination. Also skeletal here as well. Oh. Be careful. Okay, great. You can come back.
Dang, does that mean that my balance is bad?
Well, it's kind of hard to get on the spot too, so with the camera, but you did good going there. That's fine. All right, so far tests were negative. Balance and coordination is fine. All right, so now we're gonna finish doing your cranial nerves. So we've already did cranial nerve number 1 with the smells. We've already done number 2 with the vision. We did 3, 4, and 6 with the extraocular movements and the 6th ordinal gaze. So now we can do 5, which is your trigeminal. So basically, close your eyes for me. This is dull and this is sharp. Just let me know when you feel it. And this is trigeminal cranial nerve number 5. Okay? Dull or sharp?
Dull. Okay. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull.
Okay, great. Yeah, great. Also with cranial nerve number 5, can you clench your jaws for me? Okay, do it again. Okay, great. All right, so now we're going to do cranial nerve number 7. That is your facial nerve. So if you can raise your eyebrows for me. Okay, and puff out your cheeks. Okay, relax your cheeks now. Okay, big smile. Okay, great. Cranial nerve number 7 is intact. Okay, now we already did cranial nerve number 8 with the whisper test and the Rhino-Weber test. So we'll do number 9 and 10, which is the hypo and the vagus. Just swallowing. We pretty much did that too. You can swallow again for me. Okay, no issues with swallowing or anything? No? Alright, and now we're gonna do number 11, which is your. Move your head again.
I need to put it on.
No, you're fine. Okay, now we're gonna do your spinal nerve. You can shrug your shoulders up with resistance for me. Okay, great. It's cranial nerve number 11. And then we've already tested your hypoglossal nerve, which is number 12, where you've lifted your tongue towards your nose, down your chin, and side to side. So we already tested for that one too. Okay. All right. Okay, well that includes our examination. Did you have any questions for me about anything? No? Okay, so we're going to exclude the breast examination, of course, and the genital area. We're not going to do that.
Mm-hmm.
But just looking, your skin was uniform in color. I didn't see any variations there. I didn't see any blemishes or anything like that. Lung sounds were clear. And your heart sounds S1, S2, no deviations or murmurs. So, great assessment. All right, thank you.